So today we will be starting with chapter 2 of oral anatomy, that is permanent dentition. In the previous video we studied the first chapter. We did the question of chapter 1 or that is the deciduous dentition. Now we will be doing questions from permanent dentition. Okay, so question 1 is, the shape of the occlusal surface of the permanent maxillary first molar is. So the answer is rhomboidal. Okay, so let's see its explanation. Shapes of occlusal surface of some teeth. So permanent maxillary first premolar, it has hexagonal shape. Permanent mandibular first premolar has diamond shape. Permanent mandibular second premolar, it has a square shape. Permanent mandibular first and primary maxillary second molar, rhomboidal shape. Permanent maxillary second molar, rhomboidal with more obtuse angles. Permanent maxillary third molar, heart shape. Permanent mandibular first molar, hexagonal or trapezoidal. Primary maxillary first molar, rectangular. So learn all these shapes. It will help you in solving questions. Now second question, which of the following is the largest root? So its answer is the root of the maxillary canine. Okay, let's see its explanation. Longest root in oral cavity, maxillary canine and mandibular canine. Means maxillary canine, the answer is maxillary canine. Its crown length is 10 and root length is 17 mm. Mandibular canine, its crown length is 11 and root length is 16 mm. Okay, longest crown in maxillary arch, its central incisor, which is 10.5 mm. Longest crown in mandibular arch or longest crown in oral cavity, its mandibular canine. Maximum root length in maxillary arch or longest root in oral cavity, maxillary canine. Maximum root length in mandibular arch, mandibular canine. Shortest root of the dentition or shortest tooth in the dentition or shortest tooth in maxillary arch, it's maxillary second molar. Shortest tooth in mandibular arch, second molar. Shortest crown in the dentition or shortest crown in maxillary arch, maxillary second molar. Shortest crown in mandibular arch, second molar. Shortest root in maxillary arch or shortest root in oral cavity, maxillary second molar. Shortest root in mandibular arch, central incisor. Largest mesiodistal diameter of crown in anteriors, maxillary central incisor. Largest mesiodistal diameter of crown in oral cavity, mandibular first molar. Largest labiolingual diameter or crown in anteriors, maxillary canine. Largest buccolingual diameter of crown in oral cavity, maxillary first molar. Posterior tooth with longest root, palatal root of maxillary first molar. Largest mesiodistal diameter in primary dentition, mandibular second molar. And largest buccolingual diameter in primary dentition, it is maxillary second molar. It's a long list, but we have to remember it. So its answer is the root of maxillary canine is the largest root. Now question 3, palatogingival groove is found in. So its answer is maxillary lateral incisor. Maxillary lateral incisor contains palatogingival groove. Its explanation is maxillary lateral incisor, palatogingival groove. Mandibular first premolar, it contains mesiolingual developmental groove. And maxillary first premolar, it contains mesial marginal developmental groove. Okay, now greater crown bulk distal to faciolingual bisecting plane of a tooth is most typical of the mandibular. So its answer is canine. एक्सप्लेनेशन देख लेते हैं. Greater crown bulk distal to the facial-lingual bisecting plane of a tooth is typical of both maxillary and mandibular canines. Question 5. Largest cusp in permanent mandibular first molar is? Its answer is A. Mesiobuccal cusp. The largest cusp in permanent mandibular first molar is mesiobuccal and the smallest cusp is the distal cusp. The largest cusp in permanent maxillary first molar is mesiolingual and the smallest cusp is distolingual. Cusp of carabella is present only in some families. Question 6. In which of the tooth is the mesiodistal measurement is greater lingually than facially? So its answer is maxillary first molar. Its explanation is this is due to the presence of carabellae and larger mesiolingual cusp. It is also wider mesially than distally. Question 7. If a mandibular canine has bifurcated roots, they are most commonly placed. So its answer is facial and lingual. Explanation. Bifurcated roots and root canals are sometimes seen in mandibular canines. If they are present, they are situated one labially and one lingually. Among the anterior teeth, mandibular canines have bifurcated roots commonly. Among the posteriors, mandibular first premolars have bifid roots most commonly. Okay. So question 8 is 5 cusps are present in? Answer is maxillary and mandibular first molar. 5 cusps are present in permanent maxillary and mandibular first molars and primary maxillary and mandibular second molars. Question 9. Which of the following teeth have more than one occlusal form? So the answer is C. Maxillary first molar. So maxillary first molar have more than one occlusal form. Question 10. The most common curvature of the palatal root of maxillary first molar is? Its answer is facial. Its answer is facial. So palatal root is the longest and distobuccal root is the smallest of the 3 roots of maxillary first molar. So it's additional information that palatal root is the longest and distobuccal root is the smallest of the 3 roots of maxillary first molar. Question 11. Most common morphological variation is seen in? So its answer is maxillary lateral incisor. Maxillary lateral incisors vary in form more than any other teeth in the mouth next to the third molar. Peg-shaped pointed tubercle as part of cingulum, deep developmental grooves which extend down on the root lingually with a deep fold in the cingulum, twisted roots and distorted crowns are some of the morphologic variations seen in maxillary lateral incisor. Question 12. Which of the premolars is usually the smallest? So the answer is C. Mandibular first. Mandibular first premolar is usually the smallest. 13. A pronounced developmental groove is usually present on the mesial marginal ridge of permanent. Answer is maxillary first premolar. Maxillary first premolar contains a pronounced developmental groove which is present on the mesial marginal ridge. The mesial marginal developmental groove present in the maxillary first premolar crosses the mesial marginal ridge and ends on the mesial surface of the crown. Question 14. A distinguishing characteristic of maxillary first premolar that identifies it as right or left is the? Answer is option B. Mesial inclination of the lingual cusp. So maxillary first premolar can be identified as right or left by observing its characteristic features. First is mesial slope of buccal cusp is longer than distal slope. Second, mesial concavity or depression below the mesial contact area. Third, mesial marginal developmental groove. The lingual cusp is smaller, spheroidal, with a pointed cusp tip. The mesial and distal slopes are equal and meet at 90 degrees. The lingual cusp tip is mesial to the buccal cusp. Okay, so the answer is B, mesial inclination of the lingual cusp. Question 15. Which of the following premolars has a mesial marginal ridge more cervical than the distal marginal ridge? Answer is mandibular first premolar. Usually the distal marginal ridge is at a lower level than mesial marginal ridge, except for the mandibular first premolar, where the distal marginal ridge is at higher level than the mesial marginal ridge. Question 16. The shortest root on maxillary first molar is? So its answer is distobuccal. Distobuccal is the shortest root on a maxillary first molar. Question 17. Using occlusal morphology as guide, the mandibular third molar is similar to? So its answer is mandibular permanent second molar. Answer is option C, mandibular permanent second molar. Now question 18. The total number of cingula in each dentition is? So its answer is B, 12. Explanation is cingulum is present in the lingual surface of incisors and canines. So 6 plus 6, 12. Question 19. The mesial surface of the crown is almost parallel to the long axis and the root of a? Answer is D, mandibular canine. So in mandibular canine, the mesial surface of the crown is almost parallel to the long axis and the root. Now question 20. The root of maxillary lateral incisor, if curved, is usually in which direction? So its answer is distal. In maxillary lateral incisor, if the root is curved, it is usually curved in distal direction. Okay, so we have done 20 questions in this video. If you like this video, if it is helpful to you, please do like the video and subscribe the channel. Thank you so much.